On to Joan.
Thank you, and welcome to you all. One of the things that was a little different about this study than the 1993 study, as this committee thought it was really important that we look at some of the systemic factors and some of the issues related to the child welfare delivery system itself as issues that need both further study and that impact outcomes for children and families. There have been many policy, practice, and program initiatives over the last 20 years that have received some significant attention. The federal legislation, the Adoption and Safe Families Act, codified outcomes for children served in the child welfare system as safety, permanency, and well-being. For children to be safe and free from risk, permanency both in terms of reunification if they've been placed, if they can't be reunified, finding another permanent home through kin or adoption, and well-being. And while there's been a lot of emphasis earliest on around safety and permanence, in the recent years there's been a lot more focus on well-being, because if you just focus on a child being safe or making sure that a child has a home and a home that's safe, you may miss paying attention to the child's social and emotional development. And so more recently we've had a larger focus on well-being as well, and that's become really important in this field of child abuse and neglect. Beyond some of the specific legislative changes that have occurred over the last 20 years that are documented in the report, there have also been some service delivery reforms. For instance, differential response, sometimes called alternative response, that creates different tracks based on family need and the circumstances of abuse and neglect. Many public child welfare agencies have moved towards privatizing a greater number of their services so that they contract out services to be delivered through private agencies. There's been more focus on engaging with families in terms of service delivery and implementation of new practice models. Although there's variations in the implementation of differential response, the studies, in terms of the randomized studies, are beginning to show outcomes that are effective in terms of differential response. In terms of the needs of children in the child welfare system, they not only are served through child welfare services, but they're also served through the courts, through mental health, through health care, particularly because they often have enhanced mental health and health care needs. So we really need to have some cross-system collaboration as well as cross-system data collection so that we know who is being served in these systems. And so we've begun to make some progress as well towards not only having more data available, but using those data to really analyze the outcome for children. One of the accomplishments in that area has been through the National Study of Child and Adolescent Well-Being that was required through legislation in 1996, for which there have been 2 cohorts of following a sample of children from the time a report is made, where there's involvement in looking at outcomes for the children, for the family, caseworkers, service delivery, case records, and really a very comprehensive, it's given us a lot more information on what happens to children who are served in the child welfare system. And there are also a number of data archives that can be used to help guide decision-making and service delivery, both within child welfare and other systems. But we know, however, that there's a need for more rigorous evaluations to implement the kinds of programs that and models that we see that are being developed, and as Mary said, to begin to use better, more dissemination and implementation research to be able to bring those models to scale, particularly in the kind of complex agencies and service delivery systems that we have. The science of implementation can offer insight into successful strategies for child welfare agencies to replicate and sustain improvements, can really address also what kind of workforce you need in terms of knowledge and training and skill to be able to actually provide the services that are needed. We also need to understand the impact of multiple foster care placements as children of those children who do end up in being placed because of child abuse and neglect, what in terms of movement through the system. And we also need to make sure that we have more research related to the experiences of children in the child welfare system based on race, socioeconomic status, culture, and the impact of the various administrative structures, wanting to make sure we do research about what would a highly effective delivery system look like and how would we get there. The committee also looked at research and research challenges and infrastructure, because while we were examining research, we also had to look at the challenge of doing child abuse and neglect research. That happens for a number of reasons. Part of it has to do with the complexity of the system. These are things that are happening in communities, and there's many people and players involved. There might be multiple institutional review boards that need to make decisions about the viability of a study. We have different definitions of child abuse and neglect. We have different ways of measuring child abuse and neglect. And there are often many multiple factors that can confound the risk and protective factors. There are also sometimes ethical issues in terms of doing child abuse and neglect research or asking questions related to child abuse and neglect on other studies that are not specific. And then what happens if a person says yes? What kind of services or supports are going to be available for them? So we really need to think about this not only in terms of multiple sectors, but multiple disciplines, and of course, as we've already said, needing to make sure that we have a multidisciplinary cadre of researchers, because we're looking at many different fields of practice that intersect in terms of child abuse and neglect. So when we think about the research infrastructure that is needed, the committee really wanted to make recommendations that would ensure that there would be the recruitment and training of a dedicated cadre of child abuse and neglect researchers across disciplines, that there would be stable and sustained sources of research funding, and right now there's not one particular home for child abuse and neglect research, that we make sure that we use where we can the most sophisticated research designs, support interdisciplinary collaboration, and promote the use of multiple methodologies and develop clear measures. That requires that there be a nationally coordinated investment in child abuse and neglect research. The committee also recommended, because child abuse and neglect is a public health problem, that we consider the creation of a population-based epidemiological surveillance system like we have for cancer or HIV/AIDS, so that we can draw from multiple sources the information we need to develop a strategic approach to child abuse and neglect. There's further research that's needed, particularly to think about causal pathways of child abuse and neglect and marginalized and under-researched populations. And we need to not only sustain our current generation of child abuse and neglect researchers, but to support a new generation as well. And the last chapter in our report for the committee, before you get to the recommendations, address policy. And once again, this was an area that really was not very much addressed in the 93 report. But the committee felt not only did we need to do, as was done in the 93 report, to make some recommendations about policies that would support the child abuse and neglect research enterprise, but that we also really needed to look at the fact that there have been many more policies and legislation at the federal and state level related to child abuse and neglect that have been enacted since 1993, and there's always more proposed. And we really needed to look at the evaluation and the study of the impact and outcomes of legislation and policies related to child abuse and neglect. And this is an area that we've had little focus on, from the implementation in terms of effectiveness or the economic impact of some of these programs, so that the committee really recommended that there be a research priority related to the impact of laws and policies that address prevention and intervention and services for child abuse and neglect at the federal, state, and local levels. Let me turn it back to Anne.